Hi, I'm Brian Wilcock. There's probably nothing more frustrating in my day than to have a cytology sample that I can't interpret because of poor slide quality. I'm sure there's nothing more frustrating for you than to get back a report from me saying, can't help you. Everybody loses. I've asked my friend Rob Mason, who's visiting from Seattle, to give you a few pointers on how to get really good cytology samples. It's easy, it's quick, and let's do it.
Well, here we have a fairly typical soft tissue mass on the lateral aspect of this dog's elbow. And so there's several different techniques that we can do for aspiration cytology. And we're going to do the most simple technique, which is just a straight fine needle aspiration of it. There is controversy about whether we should prep this sterilely or not prep it. Basically, it's the same exact technique that we use for vaccination, that the needle penetrates the skin one time. And my own personal preference is not to do a surgical prep on these cases. It tends to create more aggravation to the pet. They tend to mutilate the site more. And so I've never seen a single infection from having done so. And so I take my left hand and I isolate the mass so that it doesn't kind of get away from me. And then with my right hand, I use we're using a 6 mil syringe, and I can open and close 2 or 3 milliliters of suction with one hand fairly easily with this. And so pick a syringe that's comfortable for your own grip and use one that you don't really need much more than 2 or 3 cubic centimeters of suction to be able to do an aspirate cytology. And so with the mass isolated, I probably try to get samples from 2 different areas of the mass. If it feels fluctuant, it's very likely that the center of the mass will be fluid filled. Sometimes the fluid is diagnostic if it's a purulent mass, if it's an abscess, and you'll probably know that by the character of the fluid. On the other hand, if it's solid, then I'll sometimes take samples from the center as well as samples more from the periphery using a totally different set of apparatus. For illustration purposes, we're just going to take one right from the center of the mass. And so we're also presuming that our patient in this case, because we're using such a fine needle, if the mass is not painful to digital palpation, it typically does not need to be frozen. It doesn't need local anesthetic. If it's painful, then the patient is oftentimes sedated, and then based on the level of analgesia we get with sedation, we may or may not do local infusion of local anesthetic as well. So if it's not particularly painful and you're using a small needle, then typically I do it without any sort of local anesthetic. And so testing the syringe a little bit first to make sure that's not frozen or stuck there. Then I angle, resting my hand up here, I angle the needle in on probably a 30 to 45 degree angle. And then once I'm in the center and I've got the mass immobilized with my other hand, now I draw back, and with the suction at 2 or 3 cubic centimeters, now I make a fanning motion. And I'm not trying to fill my syringe with material. What I'm attempting to do is to get cells into the needle, and that's my goal. Once they start to appear in the translucent portion of the hub of the needle, I'm done. I don't want to fill the whole syringe up. I risk aspirating a blood vessel, and as soon as we do that, now we've diluted out our diagnostic sample with a zillion blood cells, and that's not helpful to the pathologist. When we're making the smears, because we don't really have any air left in our syringe and we've got hopefully a needle full of our diagnostic material, I take the needle off of the syringe and I put a few milliliters of air back into the syringe. And then I gently, and sometimes even just by putting this on, you may start to express the sample. So I put the syringe back onto the needle over top. You may only have 1 drop of good material inside of that needle. You don't want to lose it. And then once I have it here, I gently express it onto the slide. Resist the temptation to really spray it out, because you may damage the cells coming out at high velocity when they hit the slide. So we have a nice sample of material on our slide. And so damaging the tissue by rapid expulsion is one area. The second area where people can damage the tissue is now that it's on the slide, what do we do with it? There are several techniques described on how to spread the material. And when it's of this consistency, when it's fairly thick and cellular, I tend to use what I don't like the term crush technique, but I tend to use the slides like this, and I gently place it together so the weight of the slide is what causes the dispersion. I don't put any pressure down on the slide. And with the weight of the slide, I gently pull them apart, and now there should be, hopefully, a nice feather edge to the material, and the feather edge is where the pathologist is going to see the thinnest film, and that's the part where the diagnosis will be made. The thicker area here is oftentimes too thick for the pathologist to be able to make a good diagnosis on that. And so I'm aiming to try to get a nice 2 or 3 little feather edges on the smear before I run off of the runway. So alternatively, with our biopsy material on the slide, we have the option to do a sliding technique. This works very well with fluid samples, blood samples or anything that's fluid, and viscous samples may not spread quite as much. With the sample slide held fairly flat, I tend to put this slide at about a 10 or 20 degrees, and to be honest, I don't measure it, I just kind of eyeball it. And then with just very gentle pressure, the weight of the slide up against the slide, I pull back, and liquid slides, the capillary action will start to draw it out toward the edges of the spreader slide. And then with a not a rapid but not a slow movement, I tend to slide the material down toward the edge. And again, what I'm aiming to do is to get a feather edge, a thin edge of material before I run off the edge of the slide. So not too fast and not too slow. Now once we have the material in whichever way we've chosen to make the smear, the next most important part where samples get damaged is by drying too slowly. And drying artifacts can be a real problem. And so once you have it, just take a few moments to just gently waft the slides back and forth so that they can air dry. And heat or chemical drying are really not necessary. Just a light current of air across it for 25 or 30 seconds will dry out that thin edge. Typically what I do from this point is I will make a series of slides from a single mass, and then I will have my technician stain one of the smears to look at the quality control. When I stain the smear and I look at it, I'm not trying to make the diagnosis. That's not my area of expertise. My job is to get cells onto the slide and to give them to somebody who is an expert at looking at them. So I'm assessing the smear for cellularity and for quality of preservation of the cells. And if I feel that there's diagnostic material there, then I'm happy to send the smears off.
Here are some examples of stained cytology smears, much as I would receive every day. This first smear is an excellent sample with a fine feathered edge and an admirably thin smear. This sample is almost worthless because it is the result of spraying the aspirated material onto the slide rather than gently placing a droplet at one end and then smearing that droplet. This smear started out well, but someone forgot to actually make the smear from this droplet. The sample has simply sat on the slide and has slowly dried, and I doubt very much whether there will be anything interpretable. Here's a microscopic view of cytology cells as they should be. This is a lovely cluster of cells, perfect for cytologic interpretation. In this smear, the cells have all ruptured either because of damage during the aspiration technique or, perhaps more likely, during the actual making of the smear. Spreading the smear too quickly is a very common cause for rupture like this. We call the cells smearocytes, and they cannot be interpreted. This started out as an excellent aspiration, but the cells did not get smeared thinly enough, or perhaps not at all. With a little bit of luck, I may be able to interpret the cells around the periphery, but I can't do anything with what's in the center.
Well, now that we're happy with the quality of the smear and the slide has been appropriately labeled, we need to ship it to the pathologist. And going through all of the trouble of getting a good a good quality diagnostic sample and being happy with the quality of it on the smear doesn't help if the sample gets broken in transit. And so getting it to the pathologist in one piece is a vital part of this. There are several different shipping containers that are available to veterinary practice. This is probably the most common. And my belief is this is meant to carry it down the hall to the pathologist, not to mail it to them. So it's very often that if you just put a couple of slides in here and it gets into the mailer, that it will bend enough to cycle the glass and break it. And so these, if you're going to use them, put 3 or 4 of them together and tape them so that it's quite rigid. These are not my favorite way to transport. These cases are very commonly used by diagnostic labs as well. And the problem is that not all slides are the appropriate size for all carriers. And you may have run into the situation where trying to put the slide in causes it to bind or break. And if you can barely get it shoved in there, imagine the pathologist trying to get it out on the other end. And so, again, unless you have the appropriate carriers for the slides, I don't tend to like these either. This type of a container is probably the best. There's plenty of room for each individual slide. It's made out of styrofoam so the slides won't get stuck and broken in there, and there's plenty of space between your valuable slides so that they won't get damaged on transit. Place the slides in the appropriate slots, 1 slide per slot, and then the lid goes on and it's securely taped, and this is bomb-proof. And so now we have, in review, we've selected the sample site. We've taken an appropriate sample, we've tested the quality of control on the sample, that we're happy that we're giving the pathologist a good diagnostic sample, and we've put it in a container that will allow it to get safely to the pathologist. Just by following those simple steps, you'll increase the diagnostic yield of your cytology many, many fold, and help to delay the frustrations that you can have with getting a non-diagnostic report back because of sample quality issues.